Good evening, everyone. This is Kathy Galen, also known as the Legislative Lady from Signature Healthcare. We're here tonight at the Lexington Convention Center for the 17th Annual Kentucky Chamber Day Dinner. What this is the kickoff for the legislative session of Kentucky. It's held every year, and most of the congressional leadership are here to join in and tell us exactly what we're looking at as the legislative session begins. We'll take you on a little visit right now with some of our legislators and see if we can get some of them to give us their opinions on what the legislative session is going to hold for 2012. And be sure to check me out on Legislative Lady at Twitter. Thanks again, and we'll see you later. Hi, we're here with Mayor Greg Fischer from Louisville this evening. And Mayor, as you know, Signature relocated to Louisville, Kentucky, and we're very, very happy to be here in your great state. I was wondering if you could share some of your views with us as the mayor of such a large city, what you think the legislative session will look like as far as healthcare issues go, as that is our major concern in Kentucky right now, and what you see prospectively happening.
Well, everybody knows this is going to be a tough session because of the budget and the fiscal constraints. The governor's asking folks to give budgets that are 7 to 9% cuts, unfortunately. While that's going on, we have increasing health care needs, as we know, both for the elderly and then the safety net as well. So these are the kind of issues that we're very concerned about in Louisville. In Louisville also, we're dealing with the potential hospital mergers. Of course, the proposed merger just said that's not going to go through, but those institutions are going to have to do something. So how does the safety net roll out of that? What about Passport in terms of their delivery of care there? So there's a lot of real-time issues from the healthcare standpoint that are important to us. From the bigger picture, Louisville's got more companies headquartered here than any other city in lifelong wellness and aging care. We are very, very happy that Signature is one of our corporate citizens. You all have a unique corporate culture that I think is one of the best in the world. And the nucleus of these companies being in Louisville, and of course the demographics with all these companies growing, we love that. It's one of our major economic development clusters and strategies.
Thank you, Mayor. It's a pleasure to be in Louisville.
Happy 2012.
Thank you. Hi, Legislative Lady here from Signature Healthcare again. I'm here this evening with Dave Atkinson, the president of the Kentucky Chamber. Dave, you know Signature is a great sponsor of this wonderful event, and we have been for the past several years. And as a healthcare company that has just relocated to Kentucky, we're very concerned about some of the issues that the legislative session holds for us. What is your view of what this legislative session might be like?
Well, there are a lot of major issues facing this particular session. The budget of the state of Kentucky has to be written in this session, redistricting, some political things like that don't necessarily relate immediately to your health care issues, but they will create the environment in which all the other issues play out. And so you kind of have to watch the whole interplay of what's going on in the legislature in order to protect your company's interest and to be there when you need to be there to advocate certain things for healthcare. Healthcare is going to be a continuing issue in Kentucky. The Medicaid budget, what's happening with public employee health care, what's happening on the national level. States are scrambling to try to implement the new health care law. All of those things are a swirl of activity in Frankfort, Kentucky, and every other state capital in the country. And so being here during the session, working with the broader business community through the Kentucky Chamber, I think it's extremely important. It's critical for a business like yours that has to relate to what the government policies are. So I congratulate you all. You've been a terrific sponsor of this Chamber of Commerce. You've been at the table for the dialogue about what's happening in public policy as it relates to health care. And of course, we're obviously delighted that Signature is now officially headquartered in Kentucky. We couldn't be more thrilled than to have you and Joe and the others actually headquartered here. So we look forward to a productive session. We look forward to working with you.
Thank you very much. Thank you for your time, Dave, and it's a pleasure to see you again.
Okay, thanks, Ken.
Hi, we're here with Senator John Turner from the 29th District of Kentucky. And as we kick off the legislative session, Senator, can you just give us a few minutes of your thoughts as to what you think the legislative session is going to bring? As a healthcare provider in Kentucky, we have a lot of challenges. We also have Missy Allen, our administrator from Riverview, and you know Missy well because she's in your district. Just give us just a few words, if you would, about what you think we're looking at legislatively this session.
Well, there's no way to know right now. It's so early in the session because there's, all the legislation that's going to affect is not being filed. There's been several bills filed, and I haven't had a chance to review all of them. But the budget is always a concern for us because it sounds like that revenues have increased, but not enough and not fast enough. So it sounds like that there may have to be some cuts. If something doesn't come along, that's going to increase some revenue. So we're going to have to either bite the bullet and raise some revenue, or we're going to have to make some cuts that are going to hurt a lot of people.
Thank you for your time, Senator. We appreciate it. We're here this evening again, as we said, at the Kentucky Chamber kickoff to the legislative session. Right now we have Mayor Bill Dieruff from Jeffersontown with us. And Mayor, as you know, Signature came to Louisville, Jeffersontown, and brought a great company to Kentucky with many jobs, and we're very happy to be here. We're just wondering, from a long-term care perspective, what you think will be happening as far as the budget is concerned, and where do you think the state's going to go as far as issues that affect health care and long-term care?
Well, as Signature, the reason why they came to Louisville is to make a presence of all healthcare systems and make Louisville and Jeffersontown a community of all the corporate offices of healthcare. Kentucky has to realize that we're all aging. We need a presence and a population supported by the state that they will help the healthcare system in the future. The budget that they are proposing has to support us who are aging and gradually getting older, and so that it's planned for the future, not just right now. Because if we wait 10 years, it's going to be too late to try to put the system in place that's needed. We appreciate Signature moving from Florida to Kentucky to show us the way, both between them and the other big companies that are in our city, of what needs to be done in our state. The legislature has to understand that coming into the next 5-10 years, we've got a plan now in order to implement it in the next several years.
Thank you very much,
Okay.
Mayor. Hi, I'm here with Judge Executive Gary Moore, who is actually running for Congress in the 4th District of Kentucky. Gary, you just shared with us some information that you are related in some way to health care in Kentucky, being on the board of directors. And I'd like to know what your concerns are as far as health care, and if you could touch on long-term care a little bit and what you foresee taking place in Kentucky's future legislatively.
Sure. Well, long-term health care is such an important issue because of the aging population. We're facing a situation where the need is growing, but funding is just not keeping up with the growth. As we look at social service funding at the county level, we find that each year that the number of requests increase and the funds in many cases are decreasing. So we need the state legislature to have an open mind and hopefully support for all of the needs with the changes in health care, from Medicaid to Medicare and all of the surrounding issues. It's so important. So we're hoping in this session we'll see some progress, and we really encourage our state legislators to pay a little special attention to our seniors.
Thank you, Gary, and good luck with your run for Congress.
Thank you.